mondo, hello world, hola mundo, hello monde. We're here today with Professor Richard Amerling from New York, sailing in the Bay of San Diego at the American Society of Nephrology, and we were discussing about a new theory called the volume therapy. So Richard, can you tell us a little bit?
Well, the volume hypothesis is the idea that most of the mortality that we see in dialysis patients and chronic kidney disease patients is related to chronic volume overload. And that all of the markers that we typically look at to monitor patients under dialysis therapy, such as hemoglobin, albumin, and even KT/V, are all inverse volume indicators. So that the reason that low hemoglobin is associated with poor outcome is not the anemia. It is actually that it is a marker for volume overload.
Oh, okay. So did you collect data on this? Did you publish anything yet?
We've published an abstract form, and I have the paper almost finished now, looking at data in dialysis patients and showing that indicators of volume overload do predict low hemoglobin, low albumin, and low KT/V in a linear fashion.
So this is interesting story because most of our dialysis patients are probably volume overloaded, and our study using the wearable ultrafiltration device are planning to try to reduce this effect by ultrafiltering the patient in between two dialysis sessions. I think that this will probably prove, if the theory is right, removing the extra fluid overload in this patient. Right?
I'm sure that that will be true. One of the major problems we have, of course, is volume control on a 3 times a week dialysis schedule. I'm adding diuretics in patients that have residual renal function. By the way, I think that the improved mortality in patients that have residual kidney function is because they have better volume status, better volume control, better volume status. So there are a lot of ways we can look at this. Diuretic therapy can probably be used more often and more intensively, or a ultrafiltration device should give you excellent results.
All right, so for this, I think is everything, and I thank you very much for joining today Cappuccino in the Bay of San Diego, and have a wonderful day.
Ciao!